Thank you for joining us for February's free Sweet Spot class presented by B+H Apothecary. We will be discussing the peaks and valleys of living with diabetes. In this free, informative class, we'll learn key ways to prevent highs and lows, as well as key symptoms to look for with dangerous blood sugar values. Let's take a moment to review our Sweet Spot basic truths. Most of us know that there are two main types of diabetes. With some exceptions, most diabetics fall into the category of either type 1 or type 2 diabetes. If you're not sure which category you fall into, simply ask your doctor. Many times, we can also tell based on the medications you take. Remember, neither type of diabetes is worse than the other. You may get diabetes in different ways, but both types of diabetes cause harm to the body in a similar manner. Now let's take a look at what our blood sugar goals should be. Fasting blood glucose should be 70 to 130 milligrams per deciliter. Postprandial glucose, which is 1 to 2 hours after the start of a meal, should be less than 180 milligrams per deciliter. There are 3 basic ways we are able to help control the amount of blood sugar in your body, commonly called the 3-legged stool approach. The 3 legs of the stool represent healthy eating, exercise, and medications. You will notice that the 2 of the 3 legs, diet and exercise, are controlled by you. Each leg of the stool is just as important as the other. Now let's take a look at hyperglycemia. Hyperglycemia is a medical term that describes an abnormally high blood glucose or blood sugar level. There are also other conditions that can contribute to hyperglycemia, including inflammation of the pancreas, an overactive thyroid gland, or severe stress such as a heart attack, stroke, or acute trauma. It's important to monitor your blood sugar levels and take action to prevent or treat high numbers. If hyperglycemia goes untreated, it can cause many serious and long-term complications, including cardiovascular disease, nerve damage, kidney damage or kidney failure, a condition called diabetic retinopathy, where elevated blood sugar causes damage to the blood vessels of the retina, potentially leading to blindness, cataracts, which is a condition characterized by clouding of the normally clear lens of your eye, teeth and gum infections, feet problems caused by damaged nerves or poor blood flow that can lead to serious infections, bone and joint problems such as osteoporosis, skin conditions including bacterial infections, fungal infections, and non-healing wounds. Several factors can contribute to hyperglycemia in people living with diabetes, including dietary choices or not following your meal plan, being physically inactive, being injured or having surgery, experiencing emotional stress such as family conflict or workplace challenges, using certain non-diabetes medications such as steroids, estrogens, or oral contraceptives, not using enough insulin or oral diabetes medication, not injecting insulin properly, or using expired insulin. Hyperglycemia generally doesn't cause symptoms until glucose values are significantly elevated, above 200 milligrams per deciliter. Symptoms of hyperglycemia also develop slowly, or over several days or weeks. The longer blood sugar levels stay high, the more serious the symptoms become. Some early developing signs and symptoms of elevated sugar levels include frequent urination, increased thirst, blurred vision, fatigue, and headaches. Other symptoms that occur later as blood sugar levels remain high include fruity smelling breath, nausea and vomiting, shortness of breath, dry mouth, weakness, confusion, and abdominal pain. If you experience any of the signs or symptoms of severe hyperglycemia, even if they are subtle, check your blood sugar level. If your blood sugar level is 240 milligrams per deciliter or higher, use an over-the-counter urine ketone test kit. If the urine test is positive, your body may have started making the changes that can lead to diabetic ketoacidosis, a serious condition of highly elevated blood sugar. You'll need to contact your doctor to help lower your blood sugar levels safely. You should talk to your doctor or our pharmacist, Joby Hall, about managing your blood sugar levels and understand how different treatments can help your glucose levels within your goal range. Check your blood sugar levels as directed by your doctor. Check more frequently if you're ill or you're concerned about severe hyperglycemia or low blood sugar, hypoglycemia. Adjustments to your insulin program or a supplement of short-acting insulin can help control hyperglycemia. A supplement is an extra dose of insulin used to help temporarily correct a high blood sugar level. Ask your doctor how often you need an insulin supplement if you have high blood sugar. Exercise regularly as an effective way to control your blood sugar. If ketones are present in your urine, do not exercise, but contact your doctor. Exercising when ketones are present can increase your blood sugar even more. Take your diabetes medication as directed. If you have frequent episodes of hyperglycemia, your doctor may adjust the dosage or timing of your medication. Follow your diabetes meal plan and make adjustments with the help of your pharmacist if you're having trouble sticking to the plan. Eat a whole food diet and avoid sugary beverages. It's important to know when to call your doctor or seek medical assistance. Make an appointment with your doctor if you experience ongoing diarrhea or vomiting, but you're able to take some foods or drinks. You have a fever that lasts more than 24 hours. Your blood glucose level is more than 240 milligrams per deciliter despite taking your diabetes medications, or you're having trouble keeping your blood glucose within desired range. Call 911 or emergency medical assistance if you're sick and can't keep any food or fluids down, or your blood glucose levels are persistently above 240 milligrams per deciliter with ketones in your urine. If you take insulin or other diabetes medications, it's important to be consistent about the amount and timing of your meals and snacks. The food you eat must be in balance with the insulin working in your body. Work towards eating a diet of whole foods with lots of vegetables, some fruit, and healthy proteins like chicken and fish. We'll discuss more about a whole foods diet in upcoming classes. Depending on your individual diabetes plan, you may check and record your blood sugar level several times a week or several times a day. Careful monitoring is the only way to make sure that your blood sugar level remains within your target range. Keep a log of your readings and a note when your glucose readings are above or below your goal range. Also note what you did differently that day and how you're feeling when your glucose levels are high. Did you eat something that may have spiked your blood sugar? Did you exercise for an extra 20 minutes? Did you experience a stressful meeting at work? All these things will factor into your blood sugar levels. Be sure to take your medications as prescribed by your healthcare provider. It is also important to talk to your pharmacist about your medications. If there is something that is bothering you, or if you have questions about how the medications make you feel, your pharmacist is here to answer your questions. Finally, you may need to adjust your medications if you change your diet and physical activity levels. The adjustments will be individualized and will depend on exactly what you've eaten and the length of time you participated in physical activity. Talk to your pharmacist about how to make these adjustments. If you're looking to increase your activity levels and make healthy changes in your diet, that is amazing. We are here to help and encourage you every step of the way. We may need to tweak your medications, as eating healthy foods and exercising regularly can lower your blood sugar levels. You may require less diabetes medication. Sick day planning. Did you know that your levels may rise when you're sick? When you're ill, your body is under stress. To deal with this stress, your body releases hormones that help it fight disease. But these hormones can also raise blood glucose levels and interfere with the blood glucose lowering effects of insulin. As a result, it's harder to keep your blood glucose in your target range when you're sick. Talk to your doctor and pharmacist to make a plan that is specific to you, and keep these two things in mind: monitoring and medications. No matter which type of diabetes you have, measure your blood glucose and urine ketones more often than usual. If you have type 1 diabetes, you may need to measure your blood glucose and urine ketones every 4 hours. Measuring ketones is very important because these waste products are more likely to build up when you're sick and lead to ketoacidosis. If you have type 2 diabetes, checking your blood glucose 4 times a day may be enough. You might only need to measure ketones if your blood glucose is higher than 300 milligrams per deciliter. When you're sick, you will still need to continue taking your medications. Even if you're throwing up, don't stop your medications. You definitely need them because your body will be making extra sugar. If you have type 1 diabetes, you may have to take extra insulin to bring down higher blood glucose levels. If you have type 2 diabetes, you may be able to take your pills, or you may need to use insulin for a short time. In either case, work with your doctor or pharmacist to develop your sick day plan. Eating and drinking can be a big problem when you're sick, but it's important to stick to your normal meal plan as much as possible. In addition to your normal meals, drink lots of water to keep from getting dehydrated. It's easy to run low on fluids when you're vomiting or have a fever or diarrhea. Extra fluids will also help get rid of the extra glucose and possibly ketones in your blood. If you can't stick to your normal meal plan, try to intake your normal number of calories by eating easy-on-the-stomach foods such as gelatin, crackers, soups, and applesauce. Your sick day plan should contain easy-to-digest foods in case you can't stick to your regular meals. If even these mild foods are too hard to eat, you may have to drink liquids that contain carbohydrates. Aim for 50 grams of carbohydrates every 3 to 4 hours. Examples include juice and frozen juice bars. Look for 100% whole fruit. Sherbet, pudding, creamed soups, and fruit-flavored yogurt and broth. You don't have to call your team every time you have a sneeze or a sniffle, but you do want to call if you experience any of the following. You've been sick or have had a fever for days and aren't getting better. You've been vomiting or having diarrhea for more than 6 hours. You have moderate to large amounts of ketones in your urine. Your glucose levels are higher than 240 milligrams per deciliter, even though you've taken the extra insulin called for in your sick day plan. You take pills for your diabetes, and your blood glucose level still climbs to more than 240 milligrams per deciliter before meals and stays there for more than 24 hours. You have symptoms that might signal ketoacidosis, dehydration, or some other serious condition, such as your chest hurts, you're having trouble breathing, your breath smells fruity, or your lips or tongue are dry and cracked, or if you aren't certain what to do to take care of yourself. Now we will look at some serious complications caused by hyperglycemia. If your blood sugar rises high enough or remains high for a prolonged period of time, it can result in toxic acids called ketones building up in your blood and urine. Untreated hyperglycemia can cause 2 serious conditions. The first is diabetic ketoacidosis. Diabetic ketoacidosis develops when you have too little insulin in your body. Without enough insulin, glucose can't enter your cells for energy, so your blood sugar level rises, and your body begins to break down fat for energy. This process produces toxic acids known as ketones. Excess ketones accumulate in the blood and eventually spill over into the urine. Left untreated, diabetic ketoacidosis can lead to a diabetic coma and be life-threatening. The second serious complication of hyperglycemia is diabetic hyperosmolar syndrome. This condition occurs when people produce insulin, but it doesn't work properly. Blood glucose levels may become very high, over 600 milligrams per deciliter, and because insulin is present but not working properly, the body can't use either glucose or fat for energy. Glucose is then eliminated from the body via urine, causing increased urination. Left untreated, diabetic hyperosmolar syndrome can lead to a coma and life-threatening dehydration. Prompt medical care is essential when this occurs. If one of these conditions does occur, you will be treated in the hospital and given IV fluids and electrolytes to treat dehydration and insulin to lower your blood sugar levels. That will conclude our discussion on hyperglycemia. Now we'll take a look at hypoglycemia. Hypoglycemia is a condition characterized by abnormally low blood glucose levels, usually less than 70 milligrams per deciliter. Hypoglycemia is a very serious condition. If left untreated, it can lead to seizures or unconsciousness. There are certain diabetes medications that can cause low blood sugar. Older types of diabetes medications tend to cause low blood sugar more than the newer counterparts. Examples of older medications include diabinase or chloropropamide, Oronase or tolbutamide, Prandin or repaglinide, Starlix or nataglinide, and Tolinase or talazimide. You can also get low blood sugar if you take aspirin, Coumadin or warfarin, Xyloprim or alpurinol, or Probilin or probenecid with diabetes medications. You shouldn't get hypoglycemia if you take alpha-glucosidase inhibitors such as Carbs or Miglitol, biguanides such as metformin, thiazolidinediones such as Actos or pioglitazone alone, but it can happen when you take them with other diabetes medicines. You can also get hypoglycemia if you take too much insulin for the amount of carbohydrates you eat or drink. For example, hypoglycemia can occur after you eat a meal that has a lot of simple sugars, if you miss a snack, or you don't eat a full meal, if you eat later than usual, or if you drink alcohol without eating any food. It's also very important to not skip meals if you have diabetes, particularly if you're taking diabetes medications. Signs and symptoms of hypoglycemia are usually easier to identify than the signs and symptoms of hyperglycemia. Some of the things to look for include shakiness or lightheadedness, nausea or hunger, confusion or irritability, sleepiness, weakness and lack of coordination, blurred or impaired vision, headaches or tingling/numbness in the lips or tongue. Sweating, chills, and clamminess are important things to look for, especially if you're taking a beta blocker, such as atenolol, metoprolol, or carvedilol. Beta blockers can mask some of the signs of low blood sugar, with the exception of sweating and clamminess. It's important to keep track of your signs and symptoms. If you feel any of these, check your blood sugar levels to see if you might need a snack. Record your readings as well as any symptoms you may be experiencing. If your blood sugar drops below your desired range, which is typically set at 70 milligrams per deciliter or less, you still want to raise your blood sugar by consuming 15 to 20 grams of glucose or simple carbohydrates. Then retest your blood glucose levels after 15 minutes. If hypoglycemia continues, repeat by consuming an additional 15 grams of carbohydrates. Once your blood glucose returns to normal, eat a small snack if your next planned meal is more than an hour or two away. Depending on your diabetes plan, your doctor may ask you to have a snack or consume carbohydrates if your blood sugar is above 70 milligrams per deciliter, but still considered lower than your target range. Ask your doctor what the low end of your target range should be. Some examples of simple carbohydrates that are great for consuming when you experience hypoglycemia include glucose tablets or gel tubes. Make sure to read and follow the package instructions. 2 tablespoons of raisins. 4 ounces or half a cup of juice or regular soda, not diet. 1 tablespoon of sugar or honey, or 8 ounces of non-fat or 1% milk. Many diabetics will carry an injectable Glucagon Pen with them for emergency hypoglycemia treatment. Glucagon is a hormone that stimulates your liver to release stored glucose into your bloodstream when your blood glucose levels are too low. Injecting glucagon will treat severe hypoglycemia or hypoglycemia that has resulted in the loss of consciousness. Speak with your healthcare provider about whether you should carry one and how and when you should use it. Your frequent contacts, such as family members and significant others and coworkers, should also be instructed on how to administer glucagon to treat severe hypoglycemic events. Have them call 911 if they feel they can't handle the situation, or if the hypoglycemic patient passes out, does not regain consciousness, has a seizure, or if glucagon is not available. If glucagon is needed, first read the manufacturer's instructions for use. This is very important. Once you know how to use the pen, inject glucagon into the individual's buttock, arm, or thigh. The individual will usually regain consciousness in 5 to 15 minutes, and they may experience nausea and vomiting. Anytime you need glucagon, let your healthcare provider know so they can discuss ways to prevent severe hypoglycemia in the future. If severe hypoglycemia and loss of consciousness occur, do not inject insulin, as this will lower blood glucose even more. Do not provide food or fluids that may cause an individual to choke, and do not place your hands in the individual's mouth, as this may also cause them to choke. Your risk for developing hypoglycemia will be lower if you eat at regular times during the day and focus on eating whole, nutrient-dense foods. Also, never skip meals and maintain a consistent exercise level. Your goal for exercise should be 30 minutes a day, most days of the week. Start with walking. It's a great whole body exercise. Also, avoid alcohol consumption, as alcohol can cause major swings in your sugar levels depending on how much you consume. People with diabetes should always have ready access to emergency supplies for treating unexpected episodes of hypoglycemia. These supplies may include candy, sugar tablets, sugar paste in a tube, and/or a glucagon injection kit. A glucagon injection may be given by a knowledgeable family member or a friend if a hypoglycemic patient is unconscious and cannot take sugar by mouth. Most of the time, hypoglycemia symptoms occur when blood glucose levels fall below 70 milligrams per deciliter. But some people may experience blood glucose readings below this level and feel no symptoms at all. This is called hypoglycemia unawareness. People with hypoglycemia unawareness are also less likely to be awakened from sleep when hypoglycemia occurs at night. Hypoglycemia unawareness also occurs more frequently in those who have low blood glucose episodes, because this can cause you to stop sensing the early warning signs of hypoglycemia. It also occurs in people who have had diabetes for a long time, and in people who tightly control their diabetes, because this increases the chance of having low blood glucose reactions. If you think you have hypoglycemia unawareness, speak with your healthcare provider. Your healthcare provider may adjust or raise your blood glucose targets to avoid further hypoglycemia and the risk of future episodes. Many people living with diabetes, particularly those who use insulin, should have a medical ID with them at all times. In the event of a severe hypoglycemic episode, a car accident, or other emergency, the medical ID tag can provide critical information about a person's health status. Most tags are offered as bracelets or necklaces that are etched with valuable health information, such as the fact that you have diabetes, whether or not you use insulin, and whether you have any allergies. Emergency medical personnel are trained to look for medical IDs when they are caring for someone who can't speak for themselves. Some medical IDs now include compact USB drives that can carry a person's full medical record for use in an emergency. To control your blood sugar, be sure you're consistently monitoring your levels, taking your medications and insulin, and maintaining a healthy diet and exercise plan. Prevention is our goal, but also know how to handle things when you become ill or if you experience a high or low reading. Always carry carbohydrate sources or a glucagon pen with you. Talk to the people in your life, family, friends, and coworkers, and educate them on how to help you. And finally, talk to your pharmacist to develop a plan that is tailored to your needs. We're here to help you make positive changes. Want to start an exercise plan? Wonderful. Let us help you get started. Then monitor your readings and adjust your insulin or medications as needed. Remember, we're here for you. Each class we offer a sweet suggestion, something new every month to keep you on track. Tonight we will be having braised chicken with spring vegetables. Below you will find the recipe for this, including ingredients, directions, and nutritional facts. Enjoy. Thank you for participating in our free Sweet Spot class. Please join us for our next class, Thursday, March 19th at 6:30 p.m. at the Booneville Family Life Center located in downtown Booneville, Kentucky. The class will be presented by Joby Hall, our wonderful pharmacist here at B+H Apothecary. He will be available to answer any and all questions that you may have. Thank you, and feel free to follow us on Facebook, facebook.com/B+H Apothecary, or visit us on the web at www.bnhapothecary.com. And feel free to give us a call at 606-593-6993 6337. That's 606-593-MEDS. Thank you.